All right, so let's now go ahead and dive into each different type of shock. In general, I want you guys to remember though, I'm gonna write this up here at the top. You guys need to remember, this shock is going to cause low BP. If you guys have not already watched it, I strongly encourage you to go watch our video where we talk about the compensation mechanisms for low blood pressure, because it's gonna make so much sense, okay? So shock can lead to low blood pressure, but the question is, how can it lead to this decrease in blood pressure? There's two ways, and that's where some of these shocks differ. One way is there could be a decrease in the cardiac output, okay? So if you decrease your cardiac output, you're gonna decrease the blood pressure. The other one is a decrease in the systemic vascular resistance, or you might have even heard me write it as total peripheral resistance. Same thing, okay? So I want you to understand that shock is when there's a low blood pressure, and this low blood pressure could be due to a low cardiac output or a low systemic vascular resistance, okay? And then remember what cardiac output is dependent upon. It's dependent upon heart rate and stroke volume, okay? So now that we understand that, this is critical because we're gonna go ahead and get started now on hypovolemic. How would we consider hypovolemic shock? We'll decipher the word. Hypo means low or below the normal volume range. So it's a loss of volume. Now, when we're losing blood volume, it can come in two different flavors here. Look at this. One could be due to blood loss. So one could actually be due to blood loss. What are some certain causes of this blood loss? One of them could actually be due to maybe a GI bleed. So a GI bleed is definitely a very, very common cause of this actual blood loss. For example, a very severe peptic ulcer or a duodenal ulcer that's perforated and emptying into the actual peritoneal cavity. Another one is an abdominal aortic aneurysm. If those suckers rupture, they can spill a lot of blood into the abdominal cavity. You can lose a lot of blood very, very fast. Another one could possibly be trauma, okay? So if I got hit in the back of the head with a 2x4, or if I got shot or something like that, I'm definitely gonna start losing some blood. So certain types of trauma. Other kind of weird ones here is, you know, postpartum hemorrhage. You ever heard of postpartum hemorrhage? It's basically whenever the woman's giving birth, after the childbirth, around 24 hours after the childbirth, if the woman starts losing significant volumes of blood, like about 500 mLs to about 1,000 mLs, they consider that to be postpartum hemorrhage because you're losing a lot of blood. So another one is what's called postpartum hemorrhage. That's another one, okay? So that's another cause. Another situation besides this could even be what's called an ectopic pregnancy. This is another really bad one. This is terrible since we're on this topic of getting in this area. Ectopic pregnancy, normally whenever the ovary is ejected from the, whenever the ovum, the oocyte, is ejected from the ovary, it goes into the fallopian tubes, right where the ampulla is. And it waits for the sperm cell to fertilize it. And then when the sperm cell fertilizes it, it gets beaten by the cilia within the fallopian tubes towards the endometrium where the uterine cavity is, where it implants, okay? But let's say for some terrible reason, the actual cilia didn't beat it towards the uterine cavity, and it implanted in the actual fallopian tubes. The fetus will actually be aborted over a certain period of time, and it can actually cause a lot of blood loss. It even could lead to another condition called pelvic inflammatory disease. So this could be another one. Another thing is what's called hemoptysis. This is basically coughing up blood. This could be due to a lot of different things. There's certain situations, if a gentleman or a female has what's called esophageal varices and they rupture, or if the person has what's called Goodpasture syndrome, which is a collagen connective tissue disorder, that could also do it. Even pulmonary embolisms if they're very severe too. So you're losing a lot of blood that way. What's another way? Another one could be due to non-fluid blood loss. I'm sorry, not blood loss, but fluid, other than blood, okay? So non-blood fluid loss. So what could be that kind of cause? So other causes could be due to non-blood fluid loss. So this is like common examples of like if someone has a very severe third-degree burn. So like third-degree burns, that's actually one of the biggest things. Whenever someone gets a burn, first thing you want to take care of is to prevent them from becoming dehydrated. You got to get them fluids as quickly as possible, right? Another common cause is excessive vomiting. Or just go out the other hole. You're peeing out your butthole, right? So then you got diarrhea. That's another situation where you're losing a lot of fluid. Another type of situation could be like a bowel obstruction. If you have a bowel obstruction, it's affecting not only the absorption activities, but also food from coming down. So that can initiate vomiting. It can affect the absorption activity, and bowel obstructions can actually pull fluid into the GI tract, which is also pulling fluid from your body. So bowel obstructions, pancreatitis. Acute pancreatitis is also a very terrible one. Many different causes of pancreatitis. We're not going to go over all of them. What I'm going to say, though, is that whenever there's pancreatitis, the pancreatic proteases, which are in the pancreas, become undesirably activated, and they start digesting the pancreatic tissue. And there's a lot of pancreatic fluid that starts getting leaked out into the abdominal cavity. Terrible situation. Another one is what's called diabetic ketoacidosis. You know, in diabetes, you have what's called high glucose levels. What is that called? Hyperglycemia. Well, in hyperglycemia, whenever your blood glucose levels get really, really high, remember we talked about in the kidney, there's what's called a transport maximum. Generally, it's right around 375 milligrams per minute that can be filtered. It can filter that much glucose and reabsorb it back into the blood. In certain situations, when the glucose levels are so high that it exceeds the transport maximum, we can't reabsorb it, and it gets lost into the urine. Why is that a problem? Because when glucose leaves, guess who else leaves? Water. Water leaves also. And when you have that, you have an increased urine output. You're losing a lot of sugar and water. So you get a nice little sugary water. All right? Now, these are some of the main situations that are kind of causing this hypovolemic shock. So there's a ton of different causes. The question is, so now we know the causes. Let's write this up here. These are kind of the etiologies of the causes of hypovolemic shock.